Welcome to bowel elimination. Please read this introduction. It's very important. I don't want to read it. I know that we all can read in class. So I will give you time to read this introduction. What are your thoughts about this? It's really important, and we need to make sure when we go in patients' rooms that we don't make them feel embarrassed. Let them know that it's okay. That's a normal body function, and we need to be really aware of how they feel and how embarrassing it may be for them. But we need to let them know it's okay. They're in a different environment, and we're there to help them and care for them. With bowel elimination, there are certain terms we need to know. We need to know descriptors and significance of stools, risk of constipation during hospitalization. 4, also measure to promote diet, medications, ambulation, and additional measures like enemas and Harris flushes. So when we're listening to bowel sounds, make sure you follow the route also. How do we start? Do we start the left lower quadrant or the right lower quadrant? It should be the right lower quadrant, right? And then you go up, over, and down. So know what's in those areas that you're listening to. You see how long the intestines are? 50 to 60 inches. So an adult is generally about 50 to 60 inches. That's the colon, the large intestines. It has 7 parts, in which you guys can see right here that I won't read for you, but it tells you right here. 7 parts of the large intestine. Different things can happen in different areas. Now, when we talk about fecal elimination impairment, think of these things that can happen. Constipation, bowel diversions, hemorrhoids, flatulence, which is passing gas, incontinence, diarrhea. These are things that can happen that causes impairment with fecal elimination. Now, with that being said, what can we do? We can have elimination aids. People are constipated. What we want to tell them, if they're diarrhea, they have a diarrhea. So sometimes medications cause diarrhea. Constipation, sometimes certain medications cause constipation. But we can also tell them about foods high in fiber, maybe increase their fluid intake. Sometimes they're on stool softeners. Sometimes the dietary can help, or sometimes patients might need an enema, a Fleet's enema, or something to help their bowels go. So I want you to know this. This came from, I believe, 1210 in your book. I just wanted to highlight this area. Please read this area so you can understand the process of what's happening in our body. Ingestion, chyme, why is there flatus? Peristalsis, what is it? I want you to read that, and if you have questions, come back and let me know. Also wanted to point out to you guys, when you see something in your book says clinical alert, either Joint Commission, BRN, some higher authority, governing authority, has found this to be very important. So whenever you see a clinical alert, make sure you read it, take notes about it, and understand it, okay? Let's talk about some of the characteristics of stools. You're going to have a normal, which is brown. Yellow is infant. And if you go to page, I believe it's 112, let's look at that together. So I'm using the electronic book for fundamentals. It should be the same book that you guys have. And I'm on page 1212. And this table is 49-1, characteristics of normal and abnormal feces. As a nurse, we should know this. So then we can, things kind of that are in our mind that we say, you know what, I need to tell the doctor about this. Why are the stools black? Oh my goodness. So look at your medications first before you freak out. Are they on iron pills? Iron turns your stools black, right? But also, something could be going on with them. Are they bleeding? Is it an upper or lower GI bleed? Something could be going on with them. Pepto-Bismol affects your stools too. Okay, so we need to know what's going on. Look at this chart, you guys. I want you to look at what normal is, what the color, consistency is, if any possible causes. This is a nice chart to help you with what we can do as nursing interventions, start our critical thinking cap. So this chart is really good. Now remember I told you the page. I scrolled down or up kind of fast, but remember you can always pause this. Okay, these possible causes are really good. You know, hard, dry stools. Are they dehydrated? Right? So if they're dehydrated, what's going on with them? They need to get hydrated. So we need to encourage some fluids, provided they're not NPO or on fluid restrictions. See, this is how we start putting that bigger picture together. Look at the normal shape. Yeah, I know everybody going, oh, we got to talk about the shape of the stool. Also, yes, ma'am. Yes, sir. So I want you guys to look. It's right there in front of you. The normal shape of what the stool should look like. So I need you to make sure you know what the color, causes of it, this whole header up here, characteristics of it, if it's normal, what it would look like if it was normal, what's abnormal, and what are some of the possible causes. And with every topic, we also have to make sure that how does it affect the older adult? And what is the older adult? You guys, every time I'm talking about the older adult, I'm talking about 65 and older. Okay? So there's always sections in our book that is going to pertain to the older adult. But also look at the other factors. Diet, okay? We also can do that. Now we talk a little bit about clinical manifestations of colorectal cancer, risk factors. This is information for you to know that probably will be highlighted in MedSearch 2. This is just like a backup for the PowerPoint. So if you needed more details on these things, here is the book for you, so you can get a little bit more details. I'm going to scroll down so you can see if there's a here we go, clinical manifestations, and then after which you have fluid intake, output, activities, psychological factors, defecation habits, and then some medications. So make sure you read this area. It's a quick read. It's not very long, so make sure you read this. It's very important, and it touches on a lot of information. Pathologic conditions, anesthesia and surgery. It's broad in general, and that's how we want it for you right now at this stage in nursing. Look at the fecal elimination problem. So we talked general about it. Again, this is to help back up what we talked about. Now, this information is from your book, Fecal Elimination Problems, Constipation. I'm not going to read the paragraphs to you, but I wanted to highlight where this is at in your book. I believe I'm on page 1215. But you have box 49-1, which sample defining characteristics of constipation. So look at those. Patients telling you that they're straining, they have a painful defecation. These are things we need to notify the doctor about. Okay? And then as you continue to read, we can also talk about fecal impaction. So some patients who don't have bowel movements for a considerable amount of days, they have the results of being impacted. Fecal impaction. So if you, I'm going to slide down, so I apologize. Close your eyes because this might mess with your eyes a little bit. Okay, but I wanted to go here and show you, just in case if you overread this sentence, constipation may be defined as fewer than 3 bowel movements per week. 3 bowel movements per week. So a person who has the fecal impaction, they've had fewer than 3 bowel movements or more in that week, and now they're unable to go. So we try, when I say go, unable to have a bowel movement. So the doctors order different things for the patient. Sometimes they order a medication called Colate. So I want to make sure you read that. Last time I had someone says, well, we didn't go over medication. No one's told us about this. Well, this medication is actually in your chapter. We're not asking you detail about it. We're telling you what can happen and what you might see in the charts during your clinical rotation, and that deals with your patient. Okay, so read this area. It's really good information. Look what I found, another clinical alert. An older adult with fecal impaction may show symptoms of delirium. Assess for fecal impaction if the client with constipation problems has a sudden change in mental status. Okay, This goes, if I didn't mention it, for urinary also. If a patient all of a sudden start becoming more confused, delirium, we want to check their urine also to make sure that they're not developing a urinary tract infection. So urinary tract infection can affect them mentally, and also fecal impaction. So as nurses, we got to say, Mr. Jones was fine yesterday. All of a sudden today, he's acting a little different. Let's see what his last bowel movement was. Let's try and get a urine sample to make sure he or she does not have a urinary tract infection. Critical thinking, putting the bigger picture together. Please read this section on page 1216 about diarrhea, but also look at here, our famous little bug, C. diff. Now, we all know that C. diff causes major diarrhea. If you don't know, it does cause major diarrhea. Patient is so uncomfortable. By the time they go to the bathroom, walk to halfway to the bed, they got to turn around and go back. It's an infectious diarrhea too. So do we clean our hands with hand sanitizers? Heavens to Betsy, please do not do that. Clean your hands with warm soap and water every time entering, exiting the room, and you do all your PPEs for this patient. Now here are some causes of diarrhea, but I'll make sure you read about C. diff. That's happening in our hospitals now with patients, but make sure you read causes of diarrhea. And here is something I felt as reading your chapters was bowel incontinence. So I try to just, this is on page 1217. I just tried to highlight the areas that I thought that was important. Of course, the entire book is important that we should read, and the chapters. Now, as we continue in our nursing practice, we have to be professional in what we do. So patients may pass gas. They have flatulence. So we need to read this section, understand it, and not giggle around the patient. Oh my gosh, you did that. We have to understand sometimes patients don't even have control of it because of what's going on with their body and the disease process that they're going through. So let's make sure that we are informed. Please read this area. The three primary sources of flatus are action of bacteria on a chyme in the large intestines, swallowed air, and gas that diffuses between the bloodstream and the intestines. You can educate your patients too at the same time. Here are some factors that affect the older adult with elimination. Make sure you guys read these bullet points because they're very important. Very important. Poor fluid intake and inability to eat high fiber diets. Maybe their dentures don't fit right. Maybe they don't have a good appetite like they used to. And all of these things that are here. So make sure you read that. It's very important. Please look at these cathartics, which are drugs that induce defecation and laxatives. It's table 49-3, and I don't think I have a page number for you, but I will scroll up so you can see these and just understand these. And I'm just going to stop here, right there. Lubricants, stop right at lubricants, stool softeners. You have stimulants, irritants, osmotic salines, bulk forming. So read over here is the type, you have the action, examples, and pertinent teaching information. So this is really good information for you to read, and I want you guys all to read it. It doesn't probably take you less than 5 minutes to read this, and if you have any questions, feel free to ask. I know we currently use a lot of the Miralax for the osmotic, for example, for osmotic or saline. Miralax. We use a lot of that, and you'll see other things that are being used too. I wanted to know if you knew this about anti-diarrhea medications. Read box 49-2. This is information on anti-flatulent, passing gas, flatulence. These are some medications to help with that. But if you know the key ingredient in some of the medications, a combination of simethicone. So simethicone is that drug that helps reduces gas. So sometimes when people are having gas at home, they make sure that one of the ingredients in that is simethicone. Okay. Table 49-4 is about cleansing enemas. Look at this table so you can understand what each one is for. I found another clinical alert. Please read. Lastly, I want to leave this thought with you about a concept map on altered vowel elimination. So read through this very slowly. And this is the end of this lecture. And stay tuned for tubes and wounds.